Jones. I heard that you had a rough night. You've been not feeling so great after your first chemo treatments.
I've been dry heaving all night. I feel like I can't keep anything down. I'm so nauseous.
Oh, I'm sorry to hear that. Yeah, I saw that it looked like they had admitted you from the ER for dehydration, and it looks like low blood pressure. So let me take a quick listen to you, do a little bit of a assessment, and then I think what we'll do is maybe put an order in for an Ondansetron nurse, and then we can give that to you. The nurse will administer it before each chemo treatment, and then in between treatments as needed, we can send you home with some as well. How does that sound?
Sounds great.
Okay, I'm just going to take a quick listen to your heart, your lungs, and your belly before we move forward with that drug. Take a deep breath for me. And again. And then I'm just going to listen to your heart. Okay, I'm just going to push on your belly a little bit. Does that hurt at all?
It just makes me feel so nauseous.
Yeah, I understand. Okay, all right. Well, I think I will put that order in for Ondansetron if you want to get that for her. I think we'll do an IV here while she's in the hospital. Do you have any questions for us about?
Yeah, can you tell me more about Ondansetron?
Well, you're in luck, because I have a catchy little song for you.
Queasy, oh, it's no fun, but here's the hero, Ondansetron. Stops the nausea, stops the hurl, keeping meals down, oh yeah, that's the goal. Serotonin in the gut, trying to play tricks, but this med's a blocker, it's got a few clicks. 5-HT3, it says not today, and the queasy feeling, it's going away. Oh, Ondansetron, you're the one, blocking nausea, having fun. From chemo trips to post-op blues, you keep me up with good news. 4 to 8 milligrams, that's right, every 4 to 8 hours, day or night. But here's a heads up, keeping it real, side effects that you might feel. A headache here, a tired vibe, or maybe constipation. Oh my, heart's in rhythm, let's keep it on track. QT intervals, no joke, watch your back. A little dizzy, or a tingly feel, talk to your doc, keep it chill and real. Oh, Ondansetron, you're the one, blocking nausea, having fun. From chemo trips to post-op blues, you keep me up with good news. 4 to 8 milligrams, that's right, every 4 to 8 hours, day or night. So if you're sick or feeling low, and nausea's the big no-show, just remember this groove. Ondansetron keeps you in the mood. A little dose here, a little dose there, tell your doc for safe, good care.
So I hear Ondansetron may affect my serotonin if I'm on other kinds of drugs?
Well, it can, yeah. That's something called serotonin syndrome. So the nurse and the other nurses that are on will definitely assess you for that as you're here in the hospital getting your treatment.
So what kind of symptoms would I be feeling with?
You might have some anxiety, restlessness, like increased heart rate, all things that, you know, they'll do regular assessments on you. So we'll be able to screen you for those things, as if they notice anything like that, they would definitely address it. Okay, great. Hi, Miss Rico. How have you been these last few days?
Doing great. I don't feel nauseous anymore.
That's good to hear. Okay, great. And you feel like the chemo that you've received, you've been, other than the nausea, like have you been able to eat regular meals and sort of stay on track with feeling pretty decent?
For the most part,
Okay, great.
I think Ondansetron is a game changer.
You do. Well, I am glad to hear that. We are, as I mentioned a couple days ago when I was here, we are going to discharge you and send you home with some. So you're going to continue to have outpatient chemo. And you can take I would recommend that you take it 30 minutes before your chemo starts. And then you're going to have some at home that you can take sublingually when you need it. And it'll last for about 4 to 8 hours. So we'll call that prescription into your pharmacy for you, for your friend or family member that's picking you up to go get once you leave here. Do you have any other further questions for me about the medication?
I don't believe so.
Okay, so I just want to make sure that you were clear that we are going to put that order in for you. Ondansetron, it's also called Zofran if you look it up and want to read more about it. It is what's called a 5-HT3 agonist. So it is going to continue to help with your nausea and dry heaving as you're receiving treatment. It should hopefully eliminate the vomiting altogether because it's blocking your serotonin both centrally and peripherally, but as well as in your intestines. So I think it's going to continue to work good for you for this next bout of chemo treatment.
Okay.
Okay, awesome. I'm going to send the nurse in, but you call my office if you have any questions at all. The staff there will be happy to help you, or you can make an appointment with me. Okay, great. Good to see you. I'm glad you're feeling better.
Hello, Chico. I'm here because the doctor has given the order for you to be discharged and continue your chemo treatments on an outpatient basis. So I have a few pieces of information to go over with you. This is your discharge paperwork. As you know, the doctor changed your depression medication from your SSRI Zoloft to bupropion while you're receiving chemo and taking Zofran, since the SSRI doesn't mix well with Zofran. Be sure to continue the bupropion and not the Zoloft until the doctor instructs otherwise. Additionally, I know you have an interest in natural and herbal medicine. You'll need to stay away from St. John's wort during treatment with your new Zofran prescription as well. I want to make sure that you're clear on the side effects of the medication and which ones you should report to your doctor. The cost for this medication is about $14, and we've called your prescription into Walmart. If you don't have any other questions, then I think you should call your husband to come get you.